All right, we are now live on Facebook. You can begin whenever you're ready.
Thank you for joining us today. My name is James Gore, and I'm chair of the Sonoma County Board of Supervisors. And I want to welcome you all to our COVID-19 update for this day, Thursday, January 27th. I want to begin with a brief message from Gilbert Martinez from our communications team for our Spanish-speaking viewers. Gilbert.
Hi, everybody. There's no Spanish recording for this video today. It will be recorded for later purposes. You can view it then.
Thank you. Y entonces, para todos ustedes que hablan español como primera lengua, quiero agradecerles por compartir y reunir con nosotros hoy. No tenemos traducción en español ahora. Tuvimos problemas con nuestros socios de la compañía que ofrece ese servicio, pero lo que vamos a hacer es traducir después de grabarlo y compartirlo por Facebook y por los otros avenidas de comunicación por el condado. Entonces, gracias por su paciencia y tu interés en este asunto. So, I want to get going. As we've talked about, especially not just now, but with our special Board of Supervisors meeting last week, reviewing not only the current COVID-19 situation, but the health order. Government has many responsibilities, and the most fundamental of these is keeping our community safe. We had presentations last week from key leaders from our hospitals, from our federally qualified health centers. We had an announcement and a ground truthing as well. And also from our schools, not only from Superintendent of Sonoma County Schools, Steve Harrington, but also individual members of different school districts, superintendents. And part of our goal is always to make sure that we are clear, not only in what our rules are, but also collaborative in clarifying rules. And this follows data. And that's what it always has to do. This mission is at the forefront of every decision made by either us as the supervisors or our public health officer, Dr. Sundari Mace, and her team. It's a huge responsibility, one that neither she nor any of the Board of Supervisors takes lightly. We take this very seriously, and we appreciate all of you in your requests or your urgency for collaboration, for always improving on how we can manage not only the what of these kinds of actions, but the how. I want to say that I am here today to support our public health officer and our public health team and the decisions that they've made up until now, including the most recent one. A little over 2 weeks, there was a temporary order for 30 days put to limit the size of large gatherings to prevent super spreader events that could overwhelm our hospitals. We had reports from those same hospital leaders that said their hospitals were overwhelmed. School leaders who said that capacity issues were amongst them. And at the same time, they talked about their ability to work with the county to improve that situation. It's undeniable that the Omicron virus has increased dramatically the spread of COVID in our community. It's also undeniable that we have one of the lowest capacity hospital systems in the entirety of California, especially for ICU. Something that we need to address long-term to prepare for next pandemics and other situations. But right now, we got to do the best we can with what we have before us. The decisions were based on science. They were based on our levels of not only infections for those individuals who are unvaccinated, who are taking up space. I want to be very clear about that, honor anybody, but at the same time, unvaccinated individuals who are taking up a lot of space in our ICUs, and limiting the ability of other folks who have normal issues. I say, God, how can you say emergency room and normal at the same time? But think about somebody I talked to in my school, a parent who came up to me and said that she took her daughter, who's in the class with my son, Jacob, and had to wait 6 hours for an appendicitis procedure. It was dangerous, it was frustrating, it was scary. And as much as we want to depend upon the other institutions in the Bay Area, we have to also take care of our own. Every one of our decisions ripples all the way into the emergency room. Even if those of us who contract COVID and are vaccinated and boosted do not get urgently ill, if we infect others, if we infect entire teams, if our kids do that, then we have to take account for our downstream actions. That's what responsibility is life. That's what comes with rights. I want to commend our businesses, schools, our parents, our students for calling in and talking with us, and for Dr. Mace and her team for following up with them. Throughout this pandemic, we've done our work to make sure that anything we do, we can do better. And I want to apologize on my behalf for not setting up, as the new chair of the board, a meeting that brought everyone together before the announcement of our last meeting. Part of leadership is ownership, not putting it on others, putting it on ourselves. And that's why we're here today. We didn't want to wait until we got a special meeting on Friday or anything else. We need to own up and do what we need to do. So Dr. Mace, I'm going to pass it over to you. This is not a lifting of temporary limits on large gatherings today. We have 2 more weeks of this temporary health order. From my conversations with you, we're bending the curve in the right way. And also, I want to thank our community for listening to not an order, but a recommendation to limit your interactions with people. This impacts businesses, but we all know that we never want to go back to those dark days of closing down businesses, of closing down in-person learning, and shutting down our lives. So with that being said, I'm going to pass it over to you so you can clarify some aspects of the order. And I appreciate you and your team, and onward.
Great. Thank you so much, Chair Gore. I couldn't agree more with everything that you've said so far. A little over 2 weeks ago, on January 10th, we placed temporary restrictions on the size of large events, 50 people or less at indoor events, and 100 people or less at outdoor gatherings, unless social distancing was possible, at which point more than 100 people could be outdoors. We have actually seen some very promising results since then. Transmission of COVID-19 was at unprecedented levels in Sonoma County when we announced the temporary restriction. It's dropped off significantly in the last 2 weeks. I'm going to show the data in some slides here shortly, but we're now seeing just a little under 200 new cases of COVID every day. And at the peak, we were at about 250 new cases of COVID every day per 100,000 residents. Hospitalizations also appeared to have peaked and plateaued, and hope that they've started to decline. It looks that way. Other counties in the Bay Area are seeing similar trends. While it's too soon to declare an end to the winter Omicron surge, there is reason for us to be optimistic that the worst may be behind us. We think our 30-day restriction on the size of gatherings has helped us turn the corner and ease some of the stresses experienced by our hospitals and other healthcare partners who really faced and are still facing staffing challenges as they struggle to take care of the sick patients, while large numbers of their own workforces were also out with COVID-19. The limits on the size of gatherings were not just intended to protect our hospitals and the people who rely on them for care, but also to protect the people who've been disproportionately hurt by this pandemic. Our seniors, our essential workers, and people who've been disadvantaged by inequities that exist in our county. And these temporary limits were intended to protect our schools. We know education suffered greatly when schools shifted to remote learning in 2020 and 2021, despite the best efforts of our hardworking educators. We wanted to do everything we could to keep our schools open and avoid the cancellation of extracurricular activities that are a crucial part of school experience for all of our kids. We also realized the mental health of our children is important. I know how valuable it is for children to be cheered on by their parents when they compete in a sports team or play in a band or act in a play. I know these are precious moments for parents. The need to temporarily refrain from large gatherings while COVID-19 cases are at the current levels remains unchanged. We're still seeing a lot of cases, but I do want to clarify 2 elements of the recent gathering order. Indoor events can include 50 spectators rather than 50 total people. The limit on the total number of attendees doesn't include staff involved with the event, players, performers, or news media. Indoor masking requirements remain in effect. All spectators, staff, media, performers, and athletes who are not actively exerting themselves must be masked. Social distancing of 6 feet between cohorts from the same household is highly recommended. I also want to make the clarification, as I stated that outdoor gatherings of 100 or more people are allowed when they can accommodate social distancing between individuals or cohorts of people. So in other words, if social distancing is possible in outdoor venues or settings, there can be gatherings of more than 100 people. If the event cannot accommodate at least 6 feet of distance between individuals or cohorts, the 100-person limit still applies outdoors. This health order was necessary when COVID-19 cases were spiking in the community, and we didn't know what the trend would be, whether it was going to be further up or whether we were actually going to bend the curve. And it looks like our health order has helped us bend the curve. We now believe that allowing the 50 spectators to attend the indoor events along with the performers, players, and staff will not significantly impact our case rate at this time. Outdoor events where social distancing can be accommodated should be relatively safe, particularly for people who are vaccinated. So we'll continue to watch the data closely. The health order is due to expire at midnight on February 10th. And hopefully if the current trends continue, we'll continue to see a decline in cases and we'll be well past the worst of the surge by the time the health order expires. But make no mistake, the pandemic is not over. We still, at 199 new cases per day per 100,000, are seeing about close to 4 times the peak number of cases per day that we saw a year ago. There is one thing that all of us can do to hasten the end of the pandemic and to avoid any further restrictions. Get vaccinated. And if you're eligible for the booster, get one. Appointments are available. There's multiple ways in which you can get your vaccine or your booster. Vaccine is safe. It works. It's slowing transmission of COVID-19, keeping people out of the hospital, and ensuring that people don't have really negative outcomes of COVID-19. The COVID-19 transmission rate among residents who are not vaccinated is more than twice what it is for people who have received the vaccine. And the unvaccinated are still nearly 17 times more likely to be hospitalized and almost 14 times more likely to die of COVID-19. We do have some good news from the vaccination front. Almost 80% of our eligible population has been fully vaccinated, and about 60% have been boosted. If we can push up both these numbers, we will bring an end to this pandemic. I would like to share my screen now and show just a few slides to underscore some of the data that I've presented so far. Let me put this in presentation mode. So as I noted, our Omicron surge appears to have peaked. I'm very happy to say that along with the other Bay Area counties, the transmission rate is decreasing throughout. We are still on the high side amongst even the Bay Area counties, but as you can see, everybody has seen a peak and is now seeing a downward trend. And I certainly hope that that's going to continue in a couple of weeks from now, that we'll be in a significantly better place. Again, as I said, we've gone from 247 new cases to 199 new cases per day per 100,000. Hospitalizations still remain elevated. And as Chair Gore noted, emergency room wait times are still high, but the hospitalizations are stabilizing, leveling off, plateauing, and hopefully on their way down as well. So the 30-day health order that was implemented limited gatherings to no more than, 50 people indoors and no more than 100 people outdoors, as I've mentioned, when social distancing isn't feasible. And that still remains in effect until February 10th at midnight. Recommendations were also made that residents limit non-essential activities to reduce the spread. And again, these steps were taken to protect our community, support the equity, and preserve capacity of our hospitals to serve COVID and non-COVID patients. Now, what we are now clarifying are a few different things. Let me start with what I've already discussed. So we're going to add an FAQ for the large gathering order, applying the 50-person limit to spectators in indoor performances, concerts, and sporting events, exclusive of the performers and staff that are there. And one other clarification, we have an order for booster vaccine verification for certain groups: fire, law, EMS, dentists, pharmacists, and temporary disaster shelter workers, as well as school staff. And the order had stated that people would be required to show a booster verification of getting a booster vaccine or go to twice weekly testing as of March 1st. We still are requiring compliance for the booster vaccine verification and for the wearing of surgical grade or higher grade respirators for those who are unboosted when in indoor settings. But we are going to push out the compliance date for the twice weekly testing to March 1st from February 1st. In other words, the booster vaccine verification will still be required as of February 1st, but the twice weekly testing will be extended to March 1st or when testing becomes readily available. And again, the reason for this is because, as you know, we've had a huge demand for testing and the supply has been an issue, not only in Sonoma County, but in the state and the nation. So until we can guarantee that there's enough testing supplies, we are going to shift the compliance date for twice weekly testing. And lastly, the large gathering order will expire February 10th at 12:59 p.m. So let me stop sharing and turn it back over to Chair Gore.
Thank you, Dr. Mace. I appreciate the updated clarification. As we always say, top line first. So the point here is that I just want to clarify, individuals who are either in sporting events, like if we're, we've had parents talk to us about basketball games and other things like that. So 50 people as spectators, that does not include those playing, the coaches, the other people managing the facility. Same thing for things like theaters. Those who are the crews who are working there, those who are the actors and others do not count towards that 50 person.
What I'm going to call a lens, a policy lens, to be able to provide
so I'm just confirming.
all programs, all
that's where we're at. Okay, so I want everybody to know that a lot of this is, we respect the input that's come in over the course of the last couple of weeks. There's been a lot of, we all want to be able to do everything that we did before the pandemic. We all want to be able to manage where we're at. I've mentioned it before, my daughter's basketball got canceled. It was not good. But you know what? We took it in the face, and now we're back with her practicing, but I got to stand outside and watch from outside. So she's got her first game coming up. I know that we're going to prioritize parents to be able to go to that. So it's an exciting time for us. I've had some people come to me and send me pictures of Warriors games, say, how can this many people get together if we can't do that here? I want to remind people that in some places like that, there's indoor vaccine requirements. I say vaccine because masking and vaccine sometimes flow together. But with that being said, I know that folks look out there and they want to see what's going on, but you got to realize that that we're doing our best to manage the situation in Sonoma County and want to honor that. So with that being said, that's the update from our team, and I want to pass it back over to our comms leads to take us through any Q&A.